Today class is about MRI. Here is a case I found today. It will be seen in liver arteriovenous malformation. Maybe it's not diagnosed yet, so I don't know properly. Here you can see in arterial phase the contrast was rapidly enhanced in this lesion in liver. It's just a preview of today's class. I will describe this case tomorrow after properly diagnose what it is. Here you can see this is the arterial phase of abdomen. It will be show the liver artery branch connected with this enhanced lesion. It's not properly showing there is a arterial venous malformation or not, just because it's so small. Like there is a collection was showing like it's a connected into artery. So it is the case for tomorrow. Now I will show you a arterial. Here you can see in arterial phase this area will be enhanced properly and it will be show the connected to the liver arteries. So I'll prepare this class for tomorrow. That's all. Today I will show you the MRI knee. Here you can see this is a patient of injury after 15 days. So it will be showing the edema everywhere. This is a PDFS sequence. So it will be fat will be suppressed in this sequence. This is sagittal view. Here you can see this is the patella, or this is the femur. This is the tibia bone, or here is the fibula. This is the fibula and this knee. So if you see the PCL was showing in this case, it's properly connected to the femur and tibia properly, so it's look like it's healthy, but you can see the ACL ligament was totally missing in this case. Here you can see ACL was not showing. The ACL ligament is not showing just because it has some type of injury. This is the steer sequence. If you see in steer there is a bony edema, it's showing bright in steer. So steer helps to identify if there is a bony information. Here you can see in this knee most of the area was edema, means there is a fluid in this muscle of knee. Here you can see everywhere in this knee shows brighter signal in stir. It means this is the edema in this knee. So it is a stir sequence, and after that I will show you this is a T1 cells. In T1 the fluid becoming hypo and the ligament are showing in T1. So in this sequence the ACL was not showing also, just because there is some type of injury. It's little bit different to show MRI images because it's so. Here you can see first one is the T2 image, and second one is the PDFS. In T2 the fat are bright, so that if there was any type of collection it's showing bright, so it's not identified. If you see in this area totally it's a fluid or infected fluid, so it's or edema, so it was showing in PDFS properly. So lots of the sequence are differently showing the fat suppressed, so it's properly identified if there was anything. Here you can see in this axial image, this is the femoral bone. This is the patella of this patient. Here you can see in everywhere in this patient lots of collection, so it means there is a infected in this knee and it's becoming swelling. It's totally so it's a injury case, so we need a ZRE sequence. This is the ZRE sequence of the knee. If you see there is no black hypo area in this knee, so this means it's not any type of blood or hematoma in this knee. Here you can see there is no any bleeding or hematoma in this knee. So we back to this. If like some this person was injured by the running, so in running if you have like severe injury, or it's sometimes it's just running just because of patient have heavy weight, so it's happening. The ACL ligament was fractured or injured, so that it's not missing in this place, and also there is a lots of collection in this patient. So it is the knee. I will show you the how to planning the knee. Here you can see the knee starts from here. Knee starts from here, and you will planning according to femoral bone. You will axial slice of the femoral bone perpendicularly to the femoral bone. After that you will be started from here. The patella ends here. This is the started point of axial slice, and after that you will continue up to the, here you can see this is the fibula bone. Fibula bone was in that level. Fibula bone was joined in tibia, so in this joint was needed in knee axial sequence. Here you can see this is the joint of tibia fibula. This is the joint of tibia fibula. The joint was needed in knee axial slice. This is the planing of the knee in axial. Or here you can see the sagittal planing. It will be, if you planning the sagittal image, this is the this is the sagittal plane. You will think there is a line in between the femoral bone. You will think there is a line, and in that line you will be perpendicular to the 90 degree. This line will be perpendicular to the 90 degrees, so that the ACL PCL ligament was properly visualized in this slice. So this is the planning of MRI knee, and in sagittal you will be fully cover the knee, just because if sometime there was a collection or there was a lesion in knee above the side, so it's needed in both sided to fully cover the knee. I have a notification, just 1 minute, I can check the notification. Wait just for 1 minute. Okay. Hello. Just wait. I just convert up here. Here you can see in this knee. Here you can see I will convert into, this is the axial plane of the knee. After that I show you the sagittal plane. It's simple to plan the sagittal image. You will find a line between the femoral end of both sides, and the sagittal plane was 90 degree in this line. Also you will see this line was properly, the sagittal plane was properly 90 degree according to the end of femoral bone. So it's the sagittal planing. After that I will show the coronal planing. Coronal planing was this was the half coronal planing. Coronal planing was also, so this is the coronal planing. In coronal you will perpendicular to the femoral bone ends here, and it will be covered. This may be some type of, you will be covered from here to the patella bone in coronal planning. I have one different image I will show you. In this image, here you can see the both ended point are perpendicular, and the slice was started from the middle of the patella and after the femoral bone end. You will add that much area. Here you can see in this patient the fluid collection here. In this patient, just because this patient also have history of injury. If any type of injury happen, the joints are in joints there was a collection, just because in injury it's collected the edema. Here you can see this is the ACL ligament. It's ended here. The femoral end was not connected in this ACL, so it's breaked. It's not showing the. Here you can see the slight line of ACL ligament from the femur, and other end its tibia was properly showing near to this line, but here you can see this was broken. So this is the problem of this patient. So it's simply showing in 3 mm or 3.5 mm sagittal slice of T2 and PDFS. It's properly showing. If there was any type of tear, it's called tear. Like tear means there is a injury of ligament, so it's called tear. In knee, how many sequence are needed? Here you can see in knee. I will show you every sequence. This is a PDFS. In joints, PDFS, sagittal, coronal and axial most of important, just because the PDFS was showing the ligament properly and it show every collection in this. In there was any type of collection, PDFS was showing properly the detail. The information was properly showing in PDFS. This is the PDFS of sagittal. This is the PDFS of axial. Here you can see this patient have some type of bony injury in tibia bone. It's showing edema in bone marrow. So it's mean if is it recent injury, it means there was any type of fracture. Also we need a CT scan of this knee, because lots of patients have small fracture in knee. It's not appear in MRI. The patient have some type of movement in this slice, so it's so blurry. In bone, T1 is hypo, it means there was some type of infection or some type of lesion in bone, so that the bone is not healthy. It means there was an infection. This patient was not that much problem. This is the same sequence. This is a PD coronal. We need PD coronal, normal PD coronal. This is a PD coronal, or this is a PD axial, or one T1 sagittal was needed. In T1 you will see the fluid is hypo, so it's properly identified if there was a fluid or there is a fat. If we compare with T2, if you see in T2 the fat becoming bright and fluid becoming little bit bright, so it's not properly identified if there was a edema in this area or fluid in this area, so it's not identified. So that we need a T1 scan. Here you can see this is the hypodense area in this sagittal knee image. So this is the fluid surrounding the bone, and here you can see in T2 we don't properly find if there was a fluid in this area or not. There is a fluid in this area or not, or how much area was filled with this collection. So T1 image was needed for identified if there was a fluid. So in this I will show you the every sequence. This is the sagittal T1. We need T1 sagittal only in knee. Also we need steer coronal only in knee. In this patient, the patient have injury history, so if there was an injury history, the GRE sequence was needed. It's not commendable, either it is a collection or it's a hematoma of injury, so that we need the GRE sequence. If you see in GRE bright, it means this is a edema, so you will see the edema in this lesion. But if there is a hypodense signal in this GRE sequence, it means it is a hematoma, like injury. After injury there was a bleeding, it stay in this area. If is it true, the GRE sequence will be tell us it's the bleed, either it is the bleed or it's the fluid. So if there was a trauma history, GRE sequence was needed. I will tell you the main sequence. We need in sagittal, we need T1 says, GRE says. If injury, either it's not injury, it's not needed, and T2 says. These three sequences are mandatory, but I'll show you every sequence. This is a T1, this is a PDFS, This is a T2. The both three sequence was needed for knee MRI. If there was an injury, you will add this GRE sequence. GRE was needed if there was a injury. This is the PD corner. I have a call. This is the Sagittal sequence, and we also need the Coronal sequence of PD and PDFS, or either PDFS or STIR. I don't have STIR sequence. In this case, we need PD Coronal, PDFS or STIR, or we need PD. Some cases or some radiologists needed PD sequence, but it's not necessary. If I add STIR, PD was not necessary. PDFS. Oh. So sorry. PDFS, either STIR, but PD Coronal was needed. So this is the Coronal. In knee, the sagittal image was more important. Here you can see in axial we need a PDFS and PD, and if there was a lesion, we need a DWI. What I try to write. If there was any type of lesion, we need DWI. That's all for knee planning. If you have any queries, just comment below. Okay, brother. If you have any type of question, just comment below. I will end this class here. I will create lots of PDF for classes. I will upload the classes PDF in my comment below. I will share the class PDF. When you will watch the stream, you just try to watch. If you have any type of query, just comment below. And today's class is ended here. Thanks for watching.